All right, welcome to today's webinar, Findings from the Southern Ontario's Basic Income Experience. I'm Natasha Pei, the Manager of Cities with Cities Reducing Poverty, and I'm here to introduce today's moderator to the discussion, Tom Cooper. For the past 9 years, Tom Cooper has served as the Director of the Hamilton Roundtable for Poverty Reduction, a collaborative organization formed to tackle the city's unacceptable levels of poverty. Through the Roundtable's work, Tom has engaged governments at all levels to invest in poverty reduction initiatives and work to give people experiencing poverty a voice in the decisions that affect their lives. He's advocated for social assistance rates that reflect the real cost of living, fought to end predatory lending in Ontario, and helped to co-found the Ontario Living Wage Network, which is an initiative of 30 Ontario communities endeavoring to address working poverty. Tom was involved in helping to establish Ontario's first basic income pilot, a critical research project testing whether providing a basic income could stabilize housing, improve health, and enhance social inclusion opportunities for low-income residents. Tom and the Hamilton Roundtable have partnered with us on several basic income webinars now. They keep helping us learn more and more about basic income as the discussion grows. So thank you for helping to put these together, Tom, and I'm going to let you introduce today's panel and the discussion.
Great, thank you very much, Natasha. It's great to be here. I hope everybody is staying well and safe, and it's our pleasure today to talk a little bit about a really amazing report that came out just before everything shut down at the beginning of March. And with me today online is Dr. Wayne Luchek, who's Professor, School of Labor Studies and Department of Economics at McMaster University. He's a Professor Emeritus now and has an MA in economic history. He's an economic historian, as well as a PhD in economics from the University of Cambridge. Many of us may know Wayne from his work over the last decade, really looking at precarious employment. He was lead on the PEPSO project, which stands for Poverty and Employment Precarity in Southern Ontario, which was an initiative of the School of Labor Studies along with the United Way of Toronto. So very glad to have Wayne with us today as lead of this research project, who will talk about the findings from the research team in just a few minutes. And somebody who many of us know and doesn't need an introduction, but I will anyway, Laura Katari, my colleague at the Hamilton Roundtable for Poverty Reduction. Laura has been a advisor and policy consultant for a number of years. She is intimately familiar with income security in the province of Ontario, and she most recently helped the previous provincial government in looking at income security issues through the Roadmap for Change, which was released just a couple of years ago. She's also been deeply involved, deeply intimate in the with the Ontario Basic Income Pilot Project, where she worked with myself in helping to support individuals who were in receipt of the Ontario Basic Income Pilot during the pilot phase itself, as well as advocating for its continuation after it was abruptly canceled by the incoming provincial government. So thank you very much, Laura, for joining us from your home in Hamilton. And I think to get started, I'm going to turn it over to Wayne. He has a bit of an overview of this research project and some of the really fascinating findings. So Wayne, I'll turn it over to you for the presentation.
Thanks, Tom. If I could just start, well, Tom suggests I was the lead researcher. That's a bit of an exaggeration. This credit for this report really goes to Mohammed and Tom, who encouraged Steffi and I to do this report. And they did the field work and they did most of the writing. I'm just the voice because Mohammed and Tom are too bashful to be out here. Okay, next slide if we could. So the study itself was based on an online survey and interviews with people in the Hamilton-Brantford region over the summer of 2019. And we took that information together and we put together a report. The report is available at the Labor Studies website under research, so you can read the full report there. I'm just going to give you some very quick highlights, take about 10 minutes to give you a sense of what we thought were some of the key findings of the report. Next slide, please. Okay, so I think the first thing that really is important that stands out is that basically everybody who responded to our survey reported better health. They reported better general health and better mental health, and it was pretty well universal. And again, I don't think this should be a surprise. I mean, I am an economist, so I think it's pretty easy to figure out if you get people a bit more money and a bit more security, they're going to be better off. So this alone is not a surprising finding, but I have to say it's a very encouraging finding. It says that basic income is good for a lot of people. Next slide, please. What we also found is that people who received the basic income made less use of the public health system. They went to the doctor less often. Excuse me. They're able to pay for medications. And again, these are all good things pointing to an improved health outcome. Next slide, please. The good health extended to more than just reporting I have better health, better mental health. People were less angry. They had a better outlook on life. And again, these are all very positive things that allow people to engage in their community in a much more positive way. Next slide, please. One of the surprising findings is that people adopted a better lifestyle. They smoked less and they drank less. And again, I think what this reflects is this stress that basic income took off people, and therefore they didn't have to engage in some of these behaviors, which we know from research are strategies that people use to cope with the stresses in their life. So they're smoking less, they're drinking less, and again, this has all got to be a good thing. Next slide, please. We also found that the impact of basic income extended beyond the individual into the household. So households were better off. There was less anxiety in the household, less fighting over money, but also the children reported better health. And again, living in a more stable environment. Excuse me, that shouldn't be a surprise. Next slide, please. Now, one of the, I think, more interesting things from my perspective is a different experience of people who were employed before the pilot and those who weren't. So we divided the sample into a group of people, about 2/3, who had employment before the pilot started, and the other 1/3 who were on ODSP or OW before the pilot. And the surprising result was, not that everyone benefited, because everyone did benefit, but those people who were working before the pilot actually reported better improvements than those people who are on ODSP before the pilot. And so what we're really seeing is how basic income integrated into the modern labor market, where many people are in less secure, precarious employment. So for those folks, not only did it give them more money, those who were working before the pilot, but also gave them security that the current labor market does not give a lot of people. A lot of people are they're working through temp agencies on short-term contracts, and they don't know from week to week or month to month where their income is going to come. And so what the basic income did is gave them a floor below which they cannot fall. And for those folks, they gained two positive inputs to their health: one, money, but two, security. Whereas those people on ODSP, they were already more or less getting a steady stream of income, but they got a little bit more income, and therefore their health was better off. And this showed up both in terms of general health and in mental health. Next slide, please. Okay, now this it requires a little bit of time just to explain. So what we have here is data on what did people do during the pilot who were working or not working before the pilot. So along the left-hand column, you have people sorted into what their employment situation was before the pilot. So were they in precarious employment? Were they self-employed? Did they have permanent full-time jobs? Did they not work before the pilot? And along the top row, you have their employment situation during the pilot. And so we're able to see how people moved around as a result of the pilot. What we see is the vast majority of people, they continued to work during the pilot if they were working before the pilot. So people who are in precarious employment, half of them stayed in precarious employment. About 15% went into self-employment. Only a quarter, 27%, stopped working. Those people who were not working before the pilot, the very bottom row there, for the most part, they continued not working, although about 20% moved from the not working column to the working column. Even for those people who stopped working during the pilot, who had jobs before the pilot, we know that a lot of them adopted strategies that they will likely re-enter the labor market at a later time. About half those people went back to school, probably to improve their human capital so they could get better jobs at a while. Had the pilot gone longer than it did, we may have been able to see some of those people re-enter the labor market, but because it was truncated so shortly, those plans were halted when the pilot ended. About another third of those people who stopped working, they stopped working for very rational reasons. They stopped working to help an ill child or someone who was ill in their family, or they stopped working because they were in an abusive job and just felt they needed a timeout to sort out where they were going in life. So overall, people didn't stop working, they kept working. Next slide, please. Not only did they keep working, but many of them moved to better jobs. So about a third of the people who were working before the pilot continued working during the pilot, moved to jobs that paid better. So they actually moved up the salary scale and were able to take care of themselves better than they were before the pilot. Next slide, please. About a third of them also reported that they enjoyed better working conditions. So these are people who left jobs that were particularly dangerous or hazardous, or where they were treated poorly, to now where they had jobs that they felt they were being treated somewhat better. What people didn't do was find jobs that offered better benefits, things like pensions and healthcare. And I think that's a dilemma of the strata of the labor market that many of these people work in. Remember, these are low-paid workers, often in insecure work, and benefits are few and far between for those sorts of workers. Next slide, please. Some people found jobs that offered better security. About a quarter had jobs that they thought had a better long-term perspective, a better prospects of a permanent job down at the end. But a lot of these people were still working in jobs that were marginal, precarious, and insecure. But there were some positive signs here, some green shoots. And again, had the pilot been allowed to go longer, we might have seen more people moving into jobs that had better long-term prospects. Next slide, please. Okay, so what are the conclusions here? Well, number one, basic income had a positive effect for almost everyone. Again, I don't think we should find that as a surprise. It was good for people who were employed before the pilot. It was good for people who were unemployed before the pilot. Next. Probably the more interesting finding, at least from my perspective, is that those people who were employed before the pilot actually benefited more than those who were unemployed before the pilot. And I think this should encourage us to think of basic income in a bit of a different way than it normally is presented. It's normally presented as an enhancement to our welfare programs, and it certainly was that. It was an enhancement to welfare. People didn't have to go through the ODSP hoops to get their money. They got a bit more money. That's a positive advance. But it was also a very positive policy for people who were not in that system, who were in a system of insecure, precarious work, who are piecing things together day by day and job by job. And for these people, it both gave them a floor below which they couldn't fall, which was good for their mental and physical health, but it also gave them a better outlook on life and actually made them more positive about looking for work, and actually allowed them to become engaged in the economy in a way that our labor market today doesn't, because of some of its flaws in terms of the kinds of jobs that are on offer. So in some ways, basic income can be seen as an employment policy as well as a welfare policy. Next line. The second thing that's really quite encouraging is that many of the people who continued working during the pilot actually moved to better jobs. And again, I think this is something that we all want to encourage. We want to allow people to make the best use of their skills. And sometimes people have to make short-term decisions that are not in their best interest just to put food on the table. The basic income gave them some flexibility in that and allowed them to maybe spend a little bit more time job search, maybe take a chance on a job that might work, might not work, but offered better prospects. And I think, again, that's a very positive finding of the report. Next. So I think the interesting question here, when we wrote it, this was the interesting question, is what does basic income tell us about how the labor market for insecure workers works? Can it actually have a positive impact on them? Of course, if we were writing the report today, we'd also add a section on COVID-19, but we missed the mark by 2 weeks, so there you are. But I think the report says an awful lot about how basic income might work in a period such as ours when we're facing such an economic crisis. Next slide. Okay, well, I added this in. It wasn't in the report, but this is a whole issue of the gig economy. More and more people are working in this kind of gig work. And again, how can basic income support these folks and allow them to have a healthier and better life? Next slide. Okay, so that's sort of at the top of the tree's look. Again, thanks to Tom and Mo for working on this, the Hamilton Community Foundation, and of course, Tom Cooper and Laura at the Hamilton Roundtable, who were partners in the study. And again, if you want to read the report, you can find it at the Labor Studies website at McMaster under Research, where the full report is posted. Thank you, folks.
Awesome. Thank you very much, Wayne. And Wayne, I just have a quick request. Can you just adjust your camera a little bit? We're only seeing half of your face, so perfect.
Okay.
Thank you very much. So I think near the end of our question and answer, we're going to get into our current situation around the pandemic and the economic crisis that has ensued. But first, Wayne, I'd like to ask you about the impetus for this research, and really. You talked about Tom McDowell and Mo Federosi's interest in this, but what were some of the challenges the research team faced when going back to former pilot participants who had been kicked off this program by the provincial government? For those who may not be aware, not only did the provincial government cancel the pilot project, but they also canceled the evaluation as well that people were supposed to participate in. So maybe talk to us a little bit about how this research came about, Wayne, and really what were the challenges in reaching out to some of those former pilot participants?
Well, Tom, you're absolutely right. A lot of people point to the ending of the benefits of the basic income pilot as a big loss, and that's absolutely true. But the other really big loss was a very sophisticated, large research team was put in place that would have been able to evaluate this and really provide, really for the first time in decades now, really since the Manitoba basic income experiment, a sense of how does basic income actually work in the current labor market? How does it work in an urban labor market? And I was part of that evaluation team, and we would have had access to tax records, to health records. We would have been able to go back to participants multiple times. We would have been able to survey all participants because that was a condition of being on the pilot. And we really would have had a good stock of data. Well, that all got canceled before we were able to collect a single ounce of usable data, which is really a tragedy. So from my perspective, it was that disappointment that led me to think, well, we really should be thinking about what the impact was here in Hamilton. The other motivation was we heard a lot of anecdotal evidence after the cancellation about people saying how positive the experience had been, how disappointed they were. And Mo and Tom then pushed Stephanie and I to sort of get a project underway. The challenge here, though, of course, is we didn't have access to any of the enrollment records, so we had no information on who was on the basic income. And so we really had to rely on a social outreach program. We relied on the Hamilton Community Foundation and your operation, Tom, at the Poverty Roundtable to actually contact people. And it really was through the hard work of Mo and Tom, who beat the bushes and the sidewalks, and were able to get over 200 people of the 1,000 who were in the pilot to be part of the report.
Great. Thanks for detailing that, Wayne. So Laura, you have been looking at income security issues for a long time. And you're of course familiar with the pilot project, both before, during, and after.
Yeah.
Was there anything in the report that surprised you, that genuinely surprised you, I guess?
So to rephrase it, I was surprised it captured a few things that, the use of cigarettes and alcohol decreasing, and considering it was such a short pilot time, not even 15 months for most people, I thought was amazing. The other two things for me were just reinforcing an old adage, it takes money to make money, and seeing that people that were already employed making better money than they were beforehand shows that you can have as many employment programs as you want, but until people feel secure to take risks, to have the opportunity to upgrade their skills and literally just take a chance applying for something they wouldn't normally have applied for, that takes stability. And basic income did that, and that it did that in about a year for so many people. I found that amazing. And it's how quickly the basic income was effective, I think was the big one.
Great, thank you. So next question back to you, Wayne. Is the age-old criticism of basic income has always been, if people are given money with no strings attached, they are not going to be motivated to go out and work. But this report, your report, the team's report, turns that stereotype on its head, I think. And I just want to get this quote from the report correct. You and the team wrote, both the previously employed and unemployed reported relatively high levels of motivation to search for a better paying job during the pilot. So, Wayne, what do you think accounts for that motivation? And do you think the naysayers are wrong? Do people genuinely want to contribute and go out and work when they can?
Yeah, I think that dogma that somehow people would be happy to sit back and put their feet up and watch the Maple Leafs if we give them enough money for potato chips and Coke is nonsensical. It's mean-spirited and it's irrational. People want to contribute. Work provides more than just a paycheck. It certainly provides that, and that's a very nice feature of work. But it also provides community and comradeship and purpose. And people they certainly don't get that watching the Maple Leafs. That's for sure. So I think work is a complex thing, and I think that what a lot of people don't work because they're trapped. They're trapped in a cycle of poverty, and I think what the basic income showed, and I think Laura really pointed this out clearly, is that if you give people a sort of a floor below which they can't fall, and some resources at that floor, they use those resources to better themselves. And part of bettering themselves is to contribute to society. And for most of us, contributing to society is through work. And I think the vast majority of people want to work. They want to work in jobs where they're respected and well paid. A lot of people work even when they're not well paid. And so I think this argument that somehow people will stay at home and put up their feet is mean and false. Of course, there are going to be some people like that, of course. But it's time we started designing policies not for the 1% or 2% who abuse the system, but for the 98% who can benefit.
Yeah, great response, Wayne. And I was actually giving a radio interview yesterday on basic income, and the radio host asked me a very similar question. I said, look, we've all been stuck in the house for 3 or 4 weeks now as a result of the pandemic. I think most of us are going stir crazy. We'd love to get back out there if we could. We can't, obviously, because it's not the safe thing or smart thing to do. But I think most of us would agree with your sentiment. Absolutely. So Laura, next question to you. So one of the other fascinating findings of this report were really the health outcomes. People were less stressed, and let me get this, close to 90% reported somewhat better or much better mental health. Many felt less depressed, and many had a much more positive outlook on life. So what do you think accounts for those, quite frankly, remarkable results in this report?
So we've been talking at the roundtable a long time, three catchphrases: dignity, opportunity, and a future. And I know I've said it in speaking engagements so many times. And as a basic income participant, I got to experience a change I wasn't anticipating. So I work part-time. I cobbled together my income from three different sources, ODSP being the smallest portion. And I realized that even though I was getting basically the disability portion, the $6,000 a year, that my life was radically different, and I did something I hadn't done in 16 years. And that was plan for my future. To have the ability to say, if I do X, Y, Z over the next 6 months, I can fix this, I can move here, lower my costs, do this. And I was anticipating being able to better manage my future here on in, even after the pilot. And in terms of the impact on someone's psyche, that is huge. That is simply being able to give people choice again, to have security. I don't think people realize, especially those at the lower rung of income, life becomes traumatic. Especially on social assistance, though there are those that go in these really horrible minimum wage jobs that aren't safe. Every day is a battle. And to relieve that pressure and allow people not only to feel better because there isn't that pressure there, but to be able to dream again is huge. And I don't think that cost or the implications of not having that vision, I don't think people realize how big it actually is.
Well said, Laura. So I want to now move into our last couple of questions before we get into questions from the audience here. But fast forward it to our current situation with the COVID-19 pandemic, with the economic crises we're now facing. So Wayne, you've spent a lot of time, as we've talked about over the last decade, researching and thinking about precarious work and the growth of the gig economy. Given the findings of this report, do you think that basic income is a suitable public policy response to the changing workplace landscape? And is it even more critical now, given what we've all gone through over the last 3 weeks?
So I would have a lot more confidence in answering that question had the evaluation of the pilot been able to go for the full 3 years. Because I think there are still a lot of unanswered questions. I have a sense, though, that basic income is moving in the right direction. Exactly how we design it, I think, is still open. But I think it's moving in the right direction. From my perspective, I mean, if I was speaking on February 1st rather than April 9th, on February 1st, I would have said, look, it makes a lot of sense given how the labor market has changed. The labor market needs this. I think now on April 9th, I think it's pretty clear that as a society, we needed some kind of an emergency system. And, credit to the Liberals, they're putting in place packages to help a lot of people. But, it's a bit like a quilt, you stick a piece here, a piece there, and then suddenly you find, well, your toes are still sticking out because you missed that piece. And so we could have saved ourselves an awful lot of grief had we had this kind of a program in place now. And, given that most people are arguing these kinds of health crises they're not going to happen every year, but they are going to happen. It would make a lot of sense to have a basic income that could have saved us all of the aggravation we've had over the last 2 weeks of figuring out what to do.
Yeah. Okay. Great. And so Laura, similar question to you, but from a bit of a different angle. So basic income helped many people stabilize their health and their well-being. Do you think basic income could work on a much larger scale during our current situation to provide for people's basic needs, keeping them healthy? And what do you think the government of Canada needs to do to make that a reality? And who should the government of Canada be listening to at this time?
Us. Sorry, you just slow pitched that one to me. I mean, what was I supposed to say? So right now, if you have a lower income, there are two realities actually happening. One, people on social assistance are finding it much harder to get their basic needs. They are dependent most walking to their local grocery store. With the initial rash of hoarding, I don't think grocery stores have caught up with people purchasing that extra. Health Canada asked people to, buy that little bit more each grocery shop. Well, people can't do that. So in terms of satisfying basic needs right now, basic income is called for. The CERB should go to everyone, and it's a perfect opportunity to see on a mass scale what that does. It also helps those that are frontline workers in retail, who may or may not, if their employer decided to do this, it was suggested, increase their pay during this period. Some people are taking home still less than the CERB.
Yep.
And that is horrible. So it would definitely help people feel secure. And to borrow from Hugh Siegel, this is about financial liquidity. So if we want the economy to recover right now, everyone needs to have spending power. Everyone needs to be able to get what they need and shop where they need to. If we had had a basic income, more people would have had credit facility. People with the lowest incomes either don't have it or it's been maxed out over decades of use so that they can't order express pickup. They can't do all the things that are being recommended to keep them safe.
Yep.
And there will be a disproportionate impact on those with lower incomes, as well as, of course, our seniors who are so much more vulnerable right now. So definitely go with the basic income.
Okay. Okay, thank you very much, Laura. I'm going to move into questions, and let me just grab the first one here, if I can. So I'm going to ask one from John here. So COVID-19 is a short-term problem. Eventually, science will come up with a cure and a vaccine, and this will drift into memory. Climate change is a longer-term problem that will be as universally applicable, and time is running out. Could the learning that has gone on through this pandemic be used going forward into the chaos that climate change is going to create? So that's a very pertinent question. I'll throw it open to either Laura or Wayne, whoever wants to tackle it.
Yeah, I mean, I think that's an interesting observation. Certainly, climate change is happening, and it's quite likely it's going to have major disruptions. I think the right answer to that is what the COVID-19 has shown us is the incredible gaps in how our society supports people, whether it is support at the state level through government programs or in the workplace through workplace programs. An awful lot of people are living on the edge, and it doesn't take very much to push them over that edge. And I think that's exactly what we're dealing with now, is we're dealing with a massive social and economic crisis because the system doesn't provide buffers for a lot of people. And so when the negative impacts of something like climate change or anything else sweeps through our economy, there are just a lot of people who are vulnerable and go over the edge. So I think basic income can smooth out the rough edges for an awful lot of people at not a huge cost. I think it's nonsensical to suggest it's a massive cost. It's quite affordable.
Okay,
So
great. Laura?
I just wanted to add that I think right now the government of Canada is learning the value of direct cash transfer. They know it's needed if mortgages are going to be paid. They know it's needed if rents are going to be paid. They know if we need to cut back on transportation and work on climate change, things need to change. People will not be employed in the same way. I think precarious work and the direction it's going in also shows them that need. They know that old policies, even 10 years ago, one of the questions this morning to the Prime Minister was on, we had SARS 10 years ago. Why is our emergency plan not working?
Mm-hmm.
And his response, times have changed, the labor market has changed, they know. And I think it will be an effective learning exercise for them on how to best support Canadians, for sure.
Okay, thanks, Laura. Next question is from Heather. Was there an assessment of the projected cost savings to the healthcare system with the implementation of basic income? One of the questions I get is that we can't afford it, but my feeling is we can through savings in other areas due to improved health and wellness. So.
Yeah, so I mean, our study was really very limited. We had a very small pot of money thanks to the Hamilton Community Foundation, but it was about 2% of the money we would have had the pilot evaluation been gone through the way the contract was signed with the Ministry of Community Services. So we didn't have access to that exact kind of data. All we have is indicators, and the indicators we have are people made fewer hospital visits. They were healthier, their mental health was better, they had a better outlook on life, they were more motivated, and those are all the kind of social indicators that factor into reduced public health costs. So I think there definitely would have been savings at that end. I think the other end is you see people moving into better paying jobs. And I know this is a kind of a crude economic theory kind of point of view, but if the jobs are being paid better, that's because they're contributing more to the society. And so society is gaining from that. I think people we're finding ways probably to move into more secure employment. That's going to reduce costs on things like ODSP, but also on unemployment insurance claims, et cetera. So I think there are a whole lot of savings. Look, the reality is giving people just enough to get by. This is not an oppressive cost. Yes, it's going to cost some money, but to be frank, people like me are going to lose a little bit, and it's going to be redistributed to those who need it. And this has been 3 decades, three very bad decades for people in the bottom third of our economic society. And I think it's time we shared a little bit. And so I think from that perspective, it's the right thing to do. It's not oppressively expensive, although certainly there are still conservatives who would say it is.
Well said. Laura, thoughts?
So I encountered this income security reform work that we were doing. Actually, before I say that, the RNAO has an older cost estimate of how much poverty costs us, including a breakdown for Ontario in terms of healthcare. And I believe Food Banks Ontario, who now has a new name, and I can't remember it, I'm so sorry.
Feed Ontario.
Feed Ontario recently, I think the past year, re-released the cost of poverty, which also has a breakdown. So the numbers are out there for Ontario at least, but I'm sure it's a good indicator. But my work with the healthcare system in terms of income security, they had an interesting answer to that. And they said it's not going to reduce how much we spend in the healthcare system, but that money in turn will be used to fix things we can't currently fix. hallway medicine, better technology, being able to replace old equipment and things like that. So in terms of literal cost savings, no. But yes, there'll be less doctor's visits. We can readjust where we spend money, and that's important to all of us, and especially with an aging community, being able to focus on surgeries and other needs that we have versus regular visits because everyone's getting a cold all the time because they're not eating well.
Yeah. Okay. Thank you, Laura. And I have a question from Elaine. It's very frustrating at this moment when basic income is the obvious no-brainer solution to the gaps in the CERB, and most of us by now will know what CERB is. It's the Canadian Emergency Relief Benefit that was rolled out just this week. How do we get our message out to the media and get the attention of government to implement basic income for all? What are the barriers and challenges? And so this, I'll just throw in, our last seminar, we had Sheila and Chandra from the Basic Income Canada Network, who gave us a bit of a rundown on their report from earlier this year on the policy options. So that is available to watch for those of you who may be new to these webinars, but certainly a little bit of background to this conversation. So Laura and Wayne, how do we get government's attention on basic income right now?
Well, I think this is a golden moment. As Tom said, I'm really an economic historian by training, so many people may wonder what the hell I'm doing the kind of research I do, because it doesn't seem to have much history involved. But one thing that I know from economic history is that change happens rapidly and unexpectedly. So in the 1930s, in the midst of the Depression, there was a sea change in terms of how we treated workers, how we treated pensioners, how we treated healthcare, how we treated unemployment, and these changes happened rapidly. So I think we are at a moment right now where the time is ripe for change, and change happens by people's voice. People have to complain, they have to write letters, and they have to frank, go to the well, I guess when this all ends, go to the streets, but not right now.
Great. Laura?
Take to social media right now. Target your local MPs and send them the report, talk to them, push them every day. CERB is a form of basic income for those that had a certain amount of money that they made last year. It's no questions asked, it's not verification other than how much you made last year. They're testing this. They're not calling it a basic income test. It is a basic income test. They're rolling it out. They have days of the week for last names and how fast they can enroll people. They're quite proud of how fast they can enroll people. Keep pushing. Every single person that contacts them is another notch. They're meeting with their caucuses. I don't care which party it is right now that you cheer for. Let them all know that this is a wise move. It's the perfect, as Wayne said, it's the perfect storm right now to really show how a basic income can target people that they're missing with all the patchwork programs.
Yeah, great. I have a question. I'm going to combine the two, actually. There's one from Susanna and also one from Laura around the impacts of food security. So what, maybe I'll put this out to Wayne first. Wayne, what were the impacts of basic income on food security? And what did the respondents in the survey say about food and their ability to get and maintain a healthy diet?
Yeah, there's clear evidence that people they ate better. They bought healthier food. They were able to buy food on a regular basis, and I think that's sort of the input into the meal system. You go out and you buy things that are healthier for you. But I think if you're also eating them in an environment which is not stressed and is more stable, I think that's also good for your diet. So I think overall, this really did improve food security significantly.
Laura?
So my answer is slightly more personal. but just something I've learned from experience. Being able to have that little extra money in my life allowed me to make better food choices. And I think there's a misconception out there that people don't eat well because they don't know how to cook. I learned to cook at age 9. I was a very young latchkey kid. I know how to cook. Um, but I couldn't afford fruit and vegetable, not in the amount that I could consume on the basic income pilot. Definitely not meat. Meat is expensive, and I would go without. And my own personal diabetic situation improved, um, literally did a 180 under basic income because I could afford to buy those things and make them a predominant part of my diet. And that's huge. We know as well with food banks under this crisis that demand is going to rise. And not only is it very difficult for them and unsafe for food banks to operate as they did before, um, we know through groups like Proof at the University of Toronto that food bank users are only a quarter, 1/4 of households that are actually food insecure. And with so many closures and so many people out of work right now, it's going to skyrocket. And food security and basic income go hand in hand. And it's something we really need to push as well. So thanks for bringing that up.
Yeah, yeah, absolutely. And one other stat to throw out there, 70% of the individuals here in Ontario who are going to food banks are actually in receipt of provincial social assistance programs. So you heard ODSP, that acronym stands for the Ontario Disability Support Program, as well as Ontario Works, which is general welfare. And so because rates are so low, for particularly for social assistance recipients, there's absolutely no capacity to get extra food or stock up. And so that's creating a whole series of other problems, public health and individual health, as Laura's mentioned. So one more question from our audience participants. What will be a reasonable amount of basic income? If I can remember, sorry, this is from May. If I can remember correctly, the Ontario pilot, which was canceled, was giving an individual about $1,300 a month. That's about $700 less than CERB. I assume the federal government considered 2,000 is the minimum to meet individual needs. So I suppose this question goes to, what do people need to live on right now and going forward? Laura and Wayne.
Laura, I'll let you start.
I knew that was going to happen. So there are varying ways to look at it. And I don't want to bash the pilot, but it was still operating slightly under this assumption that you could not fully get anyone out of poverty. So it was set at 85% of the poverty line in Ontario. And that just isn't good enough. Not if we want to see full community engagement, not if we want to see better health, adequately cover the true cost of rents in so many cities in Ontario, or the cost of transportation or utilities if you live remotely in Ontario, and of course across Canada, so many scenarios. We know with the market basket measure, it still needs a lot of work, especially under the housing portion. 24,000, which is CERB, is a lot closer to the median of what the poverty line should be. And I will tell you my own experience, because I got the disability supplement, and there's a reason why the extra 6,000 was there, and I'll get to that in one sec, but that brought me up to a living wage. My income ended up becoming a living wage. And I realized, and we've done work for years around living wage and how wonderful it would be for families. And I actually got to experience that for the first time in almost 20 years. And it was amazing. The 6,000 that they talk about, either part of BI or as a disability supplement, accounts not only for medical costs, but the reality that people with disabilities earn, on average, approximately half of what their non-disabled peers do. And it helps deal with long-term purchases like a new mattress at some point, or a new sofa at some point, or new clothing that hasn't worn through. So that's what that is about. Wayne, over to you.
Yeah, we have a pretty good idea what people need to have a decent life. We know that a living wage in Southern Ontario is in the high teens per hour, which means you're looking at something that's in the mid to high 30s per year in annual income, and that provides you with a living wage, not a luxurious wage, a living wage, enough to get by. But I think one has to understand that the basic income is not, let's give people a basic income and shut down the rest of the doors of social support. That's not what the idea is. Basic income puts some cash in people's pockets, but the actual amount that we should be putting in their pockets depends on what's our housing policy. So if you give people $35,000 a year in Toronto and increasingly in Hamilton, that's very difficult to have decent housing accommodations. You're certainly not going to own even a small garage at that income. So what kind of a housing policy are we going to have? What's our childcare policy? Are we going to ask people to put out $4,000 or $5,000 a year for childcare? That's going to affect what the basic income will be. What kind of child supports are we going to have? Are we going to be able to provide them with recreational activities or summer activity, et cetera, without cost? So I think that the actual amount really depends on this whole other package of supports. And I think it's quite important not to think of basic income as the end of support. It's one component of support. Yeah. And how big that basic income is depends on how all these other supports are. And to be frank, many of those other supports are not best delivered by a simple cash transfer to individuals. They're better delivered through community programs, collective programs. And so I think a lot of work has to be done to figure out how much is needed. I would suggest to you that $17,000 a year, which is what the pilot did, really is just scratching the surface.
Yeah. Great, thanks, Wayne. I have two more questions I want to get to before we wrap up. So I'm going to give one to Wayne and one to Laura. The one to Wayne, wearing his hat as an economic historian, is from Garth, and Garth asks, the COVID-19 crisis is showing us how fragile our global market economy is. How do we make the case to governments that bailout to corporations will only increase economic fragility, while bailouts for people will make it stronger?
Yeah, I think that's that's a great question to end on. I'm not sure how much time we have, but that's a very big question. And I can't profess to have all the answers, but the reality is that most of us are dependent on an economic system that exists. Capitalism, it's a labor market system, and we're dependent on corporations to give us jobs, but also to provide goods. And certainly we want that system to operate as efficiently as possible. And it's not clear to me that simply closing the borders to trade, particularly for a country like Canada, is the optimal strategy. So I think there's always going to be some degree of integration, unless we all want to eat a whole lot more bread and use a whole lot more fuel and eat a whole lot fewer oranges or pineapples. I think that's just a reality of the kind of economy that we produce a whole lot of some things and almost nothing of everything else. I think what this crisis has shown us is that there are certainly certain critical goods that relying on extended supply chains is problematic. So even the Americans have now figured out that while they may be the final producers of certain critical goods, they rely on an international supply chain to provide the inputs for those goods. So they can't just shut everyone out, because then everyone will shut them out. And so I think some degree of global cooperation is needed, but I think this crisis will cause some sober second thoughts about that trade-off between efficiency of doing some of these things globally versus sourcing them locally so we have access to them. But I don't think this means the end of globalization as we've practiced it, or at the end of globalization. I think it just means the end of globalization as we have practiced it. I think we need to put some more checks and balances in.
Interesting. Okay, thanks, Wayne. And last question to you, Laura. If you can do it in 30 seconds, that would be great. Can you just touch on some of the responses around stabilizing people's housing? Because we haven't really got into the housing component of basic income. How did basic income help people with their housing?
So basic income and housing, especially the question asked about RGI as well. So yes, people were paying more for their RGI if they got to remain in.
And that stands for rent geared to income.
Rent geared to income, sorry. Yeah. So they were paying more, but it was still 30% of their total income, which is an affordable range. Because we only had about 1,000 participants in Hamilton, the impact on our local market was not huge. But what we did see, and actually the report shows, even if people moved into better housing, if they had really nasty housing, bad landlords, mold, etc., and they decided to move, they were still frugal. They weren't going for the highest price ranges, but they were able to go with something that is closer to the local average. And that was really important, that people had the freedom to choose where to live.
Great. Okay, this has been fascinating, and if you'd like to review it, Natasha and the team are going to make this conversation available to you in a few days. So I will turn it back to you, Natasha, and thank you everybody for listening. All the best.
All right. Thank you, Tom and Laura and Wayne and everyone for joining us. Over the next few months, Tamarack is offering free webinars and live podcasts. You can equip yourself for community change by joining us for free training and capacity building webinars and live podcasts. Thank you again for joining us today. If you have any questions, comments, or feedback about this webinar, please send them to me at natasha@tamarackcommunity.ca. We look forward to hearing what you thought, and we're always looking to improve these sessions. So have a fantastic afternoon, everyone, a good long weekend. Stay safe out there, and we look forward to talking with you again next time. Bye-bye.